right. Mr. Rogers, can you please give us a brief overview of the developmental center's budget? Oh, and your wonderful assistants. Thank you.
Good morning, Madam Chair, Mr. Monning, Patricia Flannery, Deputy Director for the Developmental Centers Division in the Department of Developmental Services. Thank you. I'm going to try and move this microphone up a bit. Excuse me there. As Santi mentioned, the department operates 5 state facilities, 4 large developmental centers, and 1 small community facility. The population within these 5 facilities is 1,317 individuals as of last Thursday. About 32% of those individuals require skilled nursing care services. The remaining 68 reside in the intermediate care facility portion of our developmental centers. Each developmental center is licensed and certified as a general acute care hospital with distinct parts for nursing facility care and for intermediate care. Legislation in 2012-13 imposed a moratorium on admissions to the developmental center system, and since that time, admissions only occur as a result of court orders into the Porterville Secure Treatment Area and or individuals into Fairview Developmental Center under the acute crisis language outlined in statute. The budget proposed for 14-15 for the developmental centers is $526 million, which is a 5.4% net decrease in the budget from current year 13-14. The general fund amount of that is $275 million, which is a net decrease from current year 13-14 budget. The overall decrease is due to a number of factors, those that I think are most important to identify. A population decrease, as has been the trend in the developmental center system. We project a reduction of 132 individuals average in-center within the developmental center, and as occurs when there's a reduction in population, there's also corresponding reductions in staffing based on those adjustments. So there's a $12.8 million reduction associated with the loss of about 160 positions total. The budget is built on a restoration of federal reimbursements at Sonoma Developmental Center. I'll talk a little bit about Sonoma later on, but as you know, there are 4 units at Sonoma that are currently decertified and we do not receive reimbursement. We do project in 14-15 to have those units certified, which would restore $15.7 million, a fund shift from general fund to reimbursement. And then there is $9.2 million in the current budget associated with the program improvement plan at Sonoma Developmental Center. And that's specific to positions needed to support and maintain the licensure and certification throughout the ICF in total. And then I think the most significant of the other reductions has to do with the Lanterman closure. And while I will talk about the Lanterman closure based on the questions, the budget itself has a reduction of $22.7 million associated with the Lanterman closure planning process moving forward in fiscal year 14-15.
Thank you. Any questions, or excuse me, any comments by finance on the budget statement?
We have no comment.
Thank you very much. Elio?
We have no comment.
Okay, thank you very much. All right, our first issue under this area is the closure process at Lanterman, and please proceed.
Okay. As you know, the department, the administration announced the closure of Lanterman Developmental Center in January of 2010, and a plan was submitted to the legislature in April of that year, and then later approved in October of 2010. Today, at Lanterman, there are 78 men and women who reside at the facility, 51 of whom live in ICF or intermediate care, 27 who live in the nursing facility. The total number of people who have transitioned out of Lanterman since the announcement is 280 men and women who have moved out of the facility. The current year, 13-14, projects a total of 120 residents to have moved out in this fiscal year. Thus far, we have had 81 men and women who have moved out of Lanterman. A significant piece of the closure planning and assuring the safety and security of people as they transition into a community setting has been the extensive amount of transition activities that have occurred to support people. During the period, the last 6 months, there have been over 100 transition planning meetings that have occurred with teams involving the resident and his or her family or circle of support. Over 900 cross-training opportunities, providers coming to the facility, the resident and staff from Lanterman going out to the providers or to the new home to be able to make sure that the providers are ready, that residents who are moving are comfortable with the move and involved in the process. And over 235 visits to community placements, so opportunities once a home's been identified for Lanterman residents to be able to go visit their new home. Today, the facility is staffed with 697 employees during the same period last week. Since the closure announcement, we have had a total of 668 staff separate from Lanterman since January of 2010. 47% are those employees who have transferred to other state departments, so they continue in state service. 31% are employees who have retired from state service, and the remaining 22% fall in an other category of perhaps limited term assignments or people who have separated from state service for a variety of reasons. Just in the past 4 months, we've had a total of 67 staff separate from the facility. And similar to the data, 51% were employees who transferred to other state departments, 42% who have retired, a bit of an increase in the employees retiring from state service. One of the areas of concern in the Lanterman closure process has been around unit consolidation. I'll refer to the units as homes for purposes of understanding the concept. In a closure process, as people leave homes, we are always evaluating the number of people who live in any one home and how we can consolidate in a way that reduces the number of times any one resident will move, but that maintains the staffing supports that we have based on our budget. Since the closure announcement at Lanterman, there have been a total of 8 home consolidations or closures that have occurred during this period of time, which is just slightly above the developmental center system average, which is about 5 homes in that same period of time for facilities not in closure. A part of the budget for the Lanterman closure has included enhanced staffing that have allowed us to maintain residences or homes at a smaller population so that we could reduce the number of times that any one person would transition. The characteristics of people who live at Lanterman today, over 50% of those still residing at Lanterman have lived at Lanterman for over 30 years. Excuse me on that one. Most of them are 40 years and above, so they're adults and have been in the system for a long time. A higher percentage of people who have profound intellectual disabilities, over 60%. And so the level of service and support that they require within the developmental center and will require as they transition out into the community setting is an important piece of their transition planning. The closure plan included some key elements of planning to be sure that we could assist people in transitioning successfully. One of those was the outpatient clinic. Trailer bill in 2010 outlined the department's ability to operate an outpatient clinic at Lanterman as a mechanism to support residents in their transition and until they could access those services in the community. For some people, for many, they have been able to access those services as they've transitioned. But there have been a few people that have utilized the outpatient clinic. Since the clinic opened in 2011, we have had 66 former Lanterman residents who have returned to receive some level of service at the clinic. 38% of those have been in dental services, and that's very consistent with what happened in the Agnews closure and the outpatient clinic at Agnews. The highest percentage was in dental services. 14% have been specifically in rehab engineering, assistive technology, adaptive equipment, modifications to wheelchairs, or those sorts of supports that an individual might need, which is unlike the Agnews closure. That was not a service that was an essential need as people transitioned out of Agnews, but it has been a service that's been used in the Lanterman closure. Any questions about the closure, the outpatient clinic?
I think you're covering them very well.
This community state staff program, another important piece of the closure planning process was the department having the authority to implement the community state staff program, which was originally designed as a program to utilize state staff who have worked with the men and women in the developmental center for extended periods of time, and to assist in the continuity of care as people transitioned into the community. The community state staff program was an important piece of the process for the Lanterman closure as well. In 2011, the department negotiated with those bargaining units that would be an important part of transition planning and came up with agreements on the selection of how we would move forward with state staff. We conducted a whole series of education and information sessions with providers and regional centers and families and staff to help them understand the program and the benefits of the program over the period of time. In 2013, we went back to the table and negotiated agreements on what it meant to Lanterman employees if they entered a state staff program, what it would mean for them relative to staff reduction and layoff in the long run. Today, we have one contract with a provider serving men and women from Lanterman. There are currently 9 Lanterman employees who are working in the community in this state staff program. We have an additional 3 staff who are in the process. They've been selected. They may be in training today to be able to move into a state staff assignment. And the contract that we're working with the provider allows, at this point, a mechanism for up to 36 employees who could work for that organization. We have advertised for 7 different classifications, and at this point, we continue to advertise for 4 classifications because there are still vacancies being sought for the state staff program. Relative to the layoff process or the staff reduction in September of 2012, Lanterman initiated the first phase of the layoff process. At that time, there were 38 positions identified as surplus. A total of 92 employees were placed on the surplus or SROA, state restriction on appointment status. At that time, we ultimately laid off 13 employees in January of 2013, and then after that fact had 2 more employees who returned and were subsequently laid off. Most recently, actually the first week of March, Chief Deputy John Doyle and I went down to Lanterman to announce the second phase, along with staff from our Human Resources Department, to announce the second phase of layoff at Lanterman. At this point, we have identified 293 positions as surplus to the Lanterman staff as of July 1st. 40 different classifications are involved in those 293 surplus positions. A total of 480 staff have received surplus or SROA status. And you may know this, the rule of thumb when you enter into a staff reduction plan is for every single surplus position you identify, the rule of 3 employees are notified based on that surplus. So if you have 3 employees in the class you've identified as surplus, all 3 are notified of their SROA status. Ultimately, the reduction would involve 293 positions, that we've identified as surplus. Our interest today always is to mitigate layoff, to work with employees in whatever way we can to help them land on their feet. An important piece of the closure process included the development of the Staff Options and Resource Center, or Career Center, that became an important piece at Lanterman. It's a center at the facility where staff can drop in and or make appointments to learn about job opportunities that are out there, whether it's in state government or in local community job opportunities. Many of the employees within the developmental center system have been in the system for a long time. And the last time they filled out an application or had to complete a resume or go through an interview may have been many, many years. So those are important skills and opportunities that we provide employees at Lanterman through the Staff Options and Resource Center. Again, all in the interest of helping employees land on their feet when faced with a staff reduction plan. The facility has offered services for more than 2,100 visits in the last couple of years since the Staff Options Center opened up. During that time, we've surveyed employees twice to better understand how we can help them and what kinds of supports they would need. We have brought in CalPERS, we have brought in EDD. We are today working with the LA County Rapid Response, which is a county employment services entity, to come in and provide opportunities for employees to learn more about what's available, about how to get prepared for a job, and again, to help them make some decisions about what will happen for them. If natural attrition does not occur and layoff is required, the layoff date would be July 8th of 2014. I mentioned in the overall budget proposal for Lanterman that a piece of it was associated, a piece of the overall decrease in the developmental center budget is associated with Lanterman specifically. We have identified in the fiscal year 14-15 really two buckets of staff needs based on the expectation that we will have residents at Lanterman come July 1st through the end of the calendar year. The expectation or the projection today is that everyone living at Lanterman will have moved out by the end of December 2014. So we have built staffing needs based on knowing that we have to maintain services and assist those individuals in transitioning into the community, as well as operations of the facility during that first 6-month period, and then staffing supports built on the second 6-month period, which is the obligation of the department to continue to maintain and operate the land while we are responsible for the land. The positions in the second half of the fiscal year are often referred to as warm shutdown, and they kind of break up into really different categories. 30% of the positions that we are proposing for that second half of the year are built on resident-related services. The trailer bill of 2010 outlined that the department would operate an outpatient clinic for as long as the department is responsible for the land. So we will continue to operate the outpatient clinic, although we won't have any residents living at Lanterman at that time. We will continue to offer or to operate the outpatient clinic. A second piece of this chunk of staffing is associated with the RRDP, or the Regional Resource Development Project. And they're outlined in welfare and institutions, and it specifically defines that the RRDP is responsible for up to 1 year after transition from a developmental center. They continue the ongoing monitoring and support, working with the regional center to make sure that every person moving out of a developmental center has a safe and successful transition. And then the last piece of that 30% is the operation of the state staff program. Although the numbers are fairly small today, if we were to increase up to that number, the supervision that's required when you have state employees who are out in a particular assignment. There's another 20% of the positions that are assigned to 24/7 operations of the campus. the security of the campus, the maintenance of the infrastructure relative to where we operate the outpatient clinic and where we have staff still working because of the outpatient clinic. And then the boilers or the operations of steam that are a 24/7 operation as well, and those are required to be staffed at all times. The remainder of the positions are really broken up into two chunks. The first chunk is those staff who are specifically assigned to close down the campus for all of the things that you have to do when you leave state property. The disposition of state property, there is a clear government code that outlines how it must be surplus and what that process looks like. The disposition of records, whether it be confidential resident, client confidential records, or it's the records of the maintenance of the accounting and all of the business operations that are associated with the facility. And then we have records that are associated with the acute care license, all of the operations, whether it's radiology and pharmacy, and it's just the disposition of all of those records. And then another piece of it is really just the maintenance of the campus itself, because we will have staff there, because we will have visitors coming through the campus. It's over about 300-acre size campus, so reducing the fire load and making sure that it continues to be a safe place for people to come on while we operate the clinic itself. I think that's...
I'm sorry, did you state how long you believe the warm shutdown will last?
The language that's in statute today is that for as long as we, the department, are responsible for the land that we will operate the outpatient clinic. So we will continue to require warm shutdown, and many of the positions associated with the warm shutdown piece of it for as long as we're responsible.
All right. Any thought on how long that would be? Not at this time.
We partner with the Department of General Services on that, and we'll continue. We've already been working with them on the Lanterman property, and we'll continue to work with the Department of General Services during this time.
And we can report back because that's an open discussion.
Okay.
We knew there would be interest in narrowing that as best we can.
Senator Monti?
Yeah, just a follow-up on that. So are there any prospective plans for that land that you can share with us?
At this time, there's nothing finalized. We haven't received any completed feasibility studies. So right now, they're just trying to evaluate that site and see.
So I guess related to that question, for which we don't have an answer today, is the commitment is to maintain the outpatient service so long as the state and the department control that land, or I should say the department controls that land. But I guess the question that we will be interested in is, as any planning for that land evolves, what is the plan then for that outpatient service? If it can no longer be provided there at Lanterman, will there be another location where those services continue, or would the services be discontinued at that time?
I think the overall plan in the transition from the developmental center to the community is for us to work to find services within, DC residents, local community as they transition out. And so as time goes on, I think the regional centers, the department, have been working very closely with the managed care plans to figure out how we can bring people into those services if they haven't already at the time of transition. And we'll evaluate as we move forward in if we continue to have a need for a particular service in working, I think, with the regional centers on figuring out how we can make that service available as we near this time frame of if we think the outpatient clinic will go away.
Yeah, I appreciate that. And as you mentioned, some of the specialized services, well, particularly dental, and then some of the engineering, the specific support for orthopedics or wheelchairs, those aren't services that are readily available in communities. And it's, I think in your testimony, that's where most of the ongoing patient services, outpatient services are offered. So It sounds like you're alert to that, and we'll look forward to how those potential voids are going to be addressed in the ultimate transition.
And we appreciate you recognizing that. In our experience of the closure of Agnew's, that was a hallmark of both oversight and our performance. So we can assure you that's an important issue for us, and I know that you'll always watch it.
Thank you. Thank you.
Thank you, Senator Monning. And I would like to just add to thank you so much for that sensitivity in the closure of Agnew's, which is in my district. Thank you very much. I do have a couple of additional questions. One, following up on Senator Monning's question, what I'd like to know, has there been any outside interest in individuals, entities in inquiring the Lanterman properties? Are you hearing from outside sources of any interest?
We are, but like I said before, there's nothing official or finalized. There's several different groups, agencies that have been interested, but nothing official yet.
Okay, thank you very much. And then if we could just discuss briefly what the process might be for disposing furniture, equipment, other assets, the animals at Lanterman, how that process will work.
Sure. Patricia Flannery. There are no more animals at Lanterman today. The process throughout our developmental center closures have been about identifying those equipment or services that are no longer needed at that particular developmental center. And first we make those available to other developmental centers if there's an interest in particular equipment or furniture that would be a benefit to another developmental center. In the case of the animals that were at Lanterman, some of those animals did go to Fairview Developmental Center, where they do have a small farm. Some of them went to local nonprofit organizations within the Lanterman, the Pomona community. So once a developmental center identifies equipment and property that we consider surplus, it is made available to other developmental centers first to take a look at it to see if it's something that could be used, and it gets transferred to another developmental center. If it's property or equipment that the developmental center is not interested in, then we go through a formal process of identifying the equipment and reporting to the Department of General Services that we have surplus state property. And Department of General Services then works with us to identify if that's property that would be relocated to another area, or if the Department of General Services then would indicate that it becomes ours to dispose of at that point. What often happens at a developmental center is what we refer to as a surplus sale, which is we are required to produce a public notice. So we put an announcement out to the local community to let them know that once the Department of General Services has given us the authority to then dispose of the equipment or property, a surplus sale is held, and it's open to the public, to people at the developmental center or surrounding communities. And the property is then sold through the surplus sale. Anything that's left after the surplus sale then gets disposed of based on the kind of equipment it is. We, in the Lanterman closure, had a fair amount of metal scrap that nobody wanted to buy, and it ended up going to local metal scrap yards who ended up purchasing it small amounts. So hopefully that answered your question.
Yes, thank you very much. Senator Monning has a follow-up.
Yes, thank you. You made reference to patient records and their disposition. Could you just share with us a little bit more? Are they preserved? Where are they preserved? For how long? Do they follow a patient to their new housing? And for deceased patients who might have lived at Lanterman in the past, is there any requirement to preserve those patient records?
Absolutely. Patricia Flannery. The developmental center system actually has what we refer to as a records repository, and it is located at a Fairview Developmental Center. And because we on occasion receive interests or requests from people who either knew someone who once lived in a state hospital developmental center, and or they may have lived in one themselves and they're interested in accessing the records. we are required to keep a framework of information for every person who lived within our system. And then there are some records that we can dispose of after a 7-year or 10-year period of time. So there's varying requirements based on the actual information that we do keep. We don't destroy records. What we have worked to do over time is to have our records scanned, which is a process they're working with at Lanterman today, so that all of the records become official on microfiche and or electronic, and then the actual paper record we are able to destroy, so that we're not storing the large paper records but actually have the files.
Thank you.